Okay, reflex testing. So now again, like we did with patients that had low back pain that are uncomfortable in the sitting position because of the compression, we need to be able to also test people's reflexes in lying. So we have Jason lying down. We're going to have him keep his head sort of in the middle here. And we have a towel roll under him because he tends to go into cranial extension. You don't always need to have that there. So you need to put the person down on the table and look at their position and decide whether you need to put something under the head. So we're going to look at, in ascending order, C5, and we're going to test the biceps even though there's overlap, C5 and C6. Then we're going to look at brachioradialis, which would be C6, maybe even a little C7, and then triceps, which is C7. So those are the ones that we would be primarily concerned about. And again, we would test just like we did before. We would test biceps on the right and then go to the other side and test biceps on the left. Brachioradialis on the right, brachioradialis on the left. Triceps on the right, triceps on the left. But I'm just going to demonstrate them on this arm. So for the biceps, we want to make sure that we have a lot of pressure on the tendon with our thumb. We try to get the patient to relax as much as possible, and then we're going to strike our own thumb and look for the elbow flexion, okay? So we could do that a couple of times to make sure that we're getting the most consistent response. That would be 2+. So then we're going to look towards brachioradialis. So I need to have elbow flexion with as much neutral pronation, supination as possible, and I'm supporting the ulna here, but holding the weight of the arm so that he can relax as best as possible. So we're going to look where the brachioradialis inserts, and we're going to go to the tendon, and we're going to try to get brachioradialis contraction. So we have to make sure that as we do this, we're not just smashing onto the bone. And then right here, you can see I'm getting some wrist extension, which I can try to do and actually produce wrist extension, which is also another C6 muscle. So then I can go to brachioradialis. It's important to do brachioradialis because you would also be looking for an inverted supinator reflex, which that would be if I'm doing testing brachioradialis, I need to see whether the fingers are flexing at the same time, because that would be an indicator of a hyperreflexive state. So brachioradialis, wrist extensor, and then typically we could try something like this. Walk around, I've got my elbow in so I can support the weight of his arm. I can control the amount of elbow flexion so that I can determine the stretch on the tendon. I can try to get him to relax, and then I can use the hammer to tap the tendon. Jason doesn't get a whole lot of reflex here, but I would need to test the other side to know if that's anything substantive for him or not.